Have you thought about your plans and some of the important decisions to make after retirement? Ellen from D&G Consulting is going to speak about that. This session aims to educate seniors and their families about the plans and decisions to make after retirement. She will be focusing on health care, benefits, being prepared in case of emergency, resources available to meet seniors' needs, and creating your own grab-and-go kit. This session will have a live Q&A.
Hello, I'd like to welcome you to this session on aging, planning for yourself and your family. I'm Ellen Feinsand, the chair of the Acton Council on Aging Board, and we'd like to share some information today that will be useful for you whether you're planning for something that's happening tomorrow or 10 or 20 years from now. So we're going to start with thinking about what living in retirement is about. It's about living your best life. It's trying to do all those things you might not have had time or willingness to do while you were working and raising a family perhaps, or moving around the country. Whatever you were doing during work years, once you're retired or semi-retired, you might have more time to do other things. We want you to, however, be prepared for the things that we can predict will happen, as well as things that may happen that we won't be able to predict. So one of the things we're going to talk about today is how to be ready for the expected and the unexpected. It's important to understand and get some information about topics that you need to know about that may be different from what you have had to experience through your working life. The areas that we're going to talk about today, which primarily are different during your later years and in your retirement, are things like health care, benefits, the legal documents that you need to have in order to put your plans in motion, planning for emergencies, and with climate change and such things that happen all the time now, there are some things we want to make sure you're ready for. Then we will discuss a very useful grab-and-go kit in the event of emergencies related to hospitalization. And then we will end with resources that are available to help you in gathering information and in being prepared. We're very much talking today about ways to make sure you're prepared. So we'll start with healthcare services. Healthcare services are needed throughout everyone's life, but there are certain things that are more likely to happen once you are retired. So things like the need for home care, which includes people living at home and needing medical and personal services, as well as potentially custodial care. Adult daycare, which is sometimes referred to as respite, and adult daycare is to help people who want to live at home but be able to enjoy social activities and support activities with others like them. And the daycare activities take place outside the home. So this allows the caregiver to be able to get a little break and or even be able to work while the person needing adult daycare gets it. Kind of like when your children and grandchildren were needing childcare. This is daytime care. Then as time goes by, some people may have greater medical needs and need things in a skilled nursing environment. That is in or outside your home. Those are people who would need help with activities of daily living, like eating and dressing and bathing and mobility. And then at the end of life, there may be a need for palliative or comfort care, which would take place outside the home. These are all healthcare services that you might want to know about as days and years go by and your needs evolve. And people in your family may need this, and you as a family member who cares and who's responsible need to know how to access these kinds of healthcare services. So, how to pay for the healthcare services we just talked about. There are categories of insurance coverage that some of which you are, I'm sure, already aware of, and some which you may need to learn more about if the need arises. So there's regular medical coverage for hospitals and doctors, durable medical equipment for walkers and wheelchairs, skilled care when someone needs to have therapy due to illness, chronic condition, or post-hospitalization. That is sometimes provided in the home or outside the home. There is also supplemental medical coverage for expenses that are not covered by regular health insurance. And there's a variety: glasses, dentures, hearing aids, dental care. Those are some of the things that would typically be covered by supplemental coverage. Prescription drugs, these may be part of other plans, but they also may be standalone. And the last category of insurance is one we hope we never need, but if a catastrophic incident occurs or a situation that requires permanent type of care, catastrophic care coverage exists. So it's something to know about just in the just in case scenarios. In today's generation, there's no place like home. People who are seniors today and getting to be older, people who are planning for when they are older, they really want to live at home. The language is aging in place. Many of you, I am sure, know people who would like to stay at home to be cared for and care for themselves as much as possible. Living at home allows you to do things that you're able to do, stay independent, manage your day-to-day life, have some fun with your friends, have your family over. All of those things are things that are aided by staying in your own home. In order to do this, it's necessary to get the help you need as your situation changes and maybe as your needs increase. Someone might just need home care for homemaking, for medication management, for nutrition, making sure the food is there, shopping. Others may need more services, but the areas that must be taken care of, whether by you yourself living at home as you age, or a family member or other caregivers, include all of these, which include financial support, transportation, social interaction. Living at home is a luxury that everyone would like to be able to have, but in order to have that and be successful and have a happy outcome while you are aging, it's very important to be prepared with all the help in these areas that you may need. People who live at home have caregivers at times. This may be family members, it may be people who are paid caregivers, it may be neighbors and friends, it may be a combination of all of these services. And in order to help the caregivers, Massachusetts has very excellent information and services. The Caregiver Support line that the Commonwealth supports is available by calling 800-AGE-INFO. That's 800-243-4636. This is a way to help caregivers get the support that they need as they are helping you remain healthy and at home. There are planning guides available from AARP. There is something called the Family Caregiver Alliance. Those are accessible online. And then respite services are always important because whoever is taking care of someone, whether they are only a little bit in need or very much in need of a lot of care, the caregiver needs to sometimes get a break. So there are formal providers and there are informal providers of respite. Respite is what it says. It is to give a rest or a respite to the usual caregiver. Caregiver services in Massachusetts have helped many people stay at home and stay healthy longer. Several of you, I'm sure, are already getting Social Security benefits, and there's important news. In January of 2022, your benefits will go up 5.9% due to the cost of living. And you will see in your January payment that you will get a larger amount. I'm sure that will be a welcome thing. Here is a list of the dates that you can begin getting, the ages you can begin getting Social Security benefits. The earliest age is 62. The latest age is 70. Any time between there, you can begin getting benefits and they will go up. But the date that is the most important is the full retirement benefit date, which comes between age 66 and 67, depending on your birthday. And that is called your normal retirement age. That's the date that if you begin getting benefits, you will get the full amount that you're eligible for. If you get it earlier, at an earlier age, there'll be a reduction. If you wait and defer it to 70, you will get an increase of 8% per year. So it bears giving some thought for the people who haven't yet begun taking Social Security benefits to think about and perhaps use some of the tools that are available on the Social Security website to help you get the most Social Security benefit that you can. The next important benefit available is Medicare. You've all heard about Medicare, probably on the news. In many ways, it's always talked about because it's a very important benefit. There are 4 parts. A is hospital insurance, Part B is medical insurance, Part C is a special kind of plan called Medicare Advantage, and Part D is for prescription drugs. All of these are determined by what your needs are and how you think is best to take care of your health and medical needs. There are costs, but Part A you've already paid for during your employment, so there's no extra monthly fee for Part A. Part B, there is a monthly premium, and it ranges from $159 to $505 monthly. That will start in 2022. And premiums are usually deducted from Social Security benefits. Then C is a whole different type of program, and the premiums vary based on the benefits and your choices. And Part D is for prescription drugs. So Medicare is flexible, and we make sure to urge you to sign up for it at age 65, regardless of whether you are retired or not. Another important benefit from the federal and state governments is Medicaid. And the essentials to know about Medicaid are that it is a combined federal and state program, and the main thing it covers that a lot of people make use of is long-term care insurance protection. So there is no cost to you for Medicaid services. The eligibility will be based on the income and assets of the beneficiary. And if the assets of the beneficiary are depleted down to $2,000, everybody at that level is eligible to get Medicaid benefits. A spousal situation may have some unique situations, and you'd need to talk to Medicaid about those. But the resources available are by phone and in person and online. So I urge you, if you are approaching age 65, to make sure you pay attention to Medicare and understand if you need Medicaid. Another important program that the federal government provides, and this is a very important program for all of the veterans who have served, It is a supplemental benefit, and it is called the Veterans Aid and Attendance Program. This is a benefit for veterans themselves as well as survivors of benefits who are eligible. You must be eligible for a regular Veterans Administration pension in order to be eligible for the Veterans Aid and Attendance Program. The benefits are paid in addition to monthly pension benefits, and the maximum net worth that you can have in order to be eligible is $130,773. You can see that the amount that a veteran would get in this program is $1937 per month. The veteran and spouse would get $2296 per month, and the surviving spouse would get $1245. So to apply for these benefits, you can do it online, or you can visit the Boston Regional Benefits office at the JFK building. I urge you to use the website as a first resource. So those are all the benefits that we're going to talk about today. Those are federal benefits, and those are benefits that you've all probably heard of. But what we're going to say now that is important is how to make this plan, all these plans about where you're going to live and how you're going to pay for your services and what insurance you need and what benefits you're eligible for, in order to get all of that going and turned into a plan that you will be secure knowing how to put your plans into action, put your decisions into place in advance of needing them. So in order to do that, it's very important to get some legal documents in order. And this is important whether you have a large family, a small family, whether you have a large asset base, a lot of assets, a home, or whether you have a simpler estate. But these documents will help you and will help your family in the future when they are needed. Some of the ones that we really emphasize that you have and that you do, that you make sure you've done these, is a will. This states what you want to happen with your possessions. We really recommend, it's very important, to designate beneficiaries. This gives instructions to anyone that has, for anyone that has an IRA or any other assets. Beneficiary designations say who will get those proceeds when the person who owned the account died. So designating beneficiaries may mean a lot to your family and heirs. Having a healthcare representative, it identifies who would make decisions if you no longer can related to healthcare and medical issues. Some of the hospitals have their own forms. Some forms of this type can be gotten online, but it is important to name a healthcare representative. It's also important to identify who would handle your financial matters if you no longer can. So that would require having a durable power of attorney. So there's a healthcare representative for the health and medical issues. There's a durable power of attorney for financial issues. And a durable power of attorney means somebody can take care of your finances if you no longer can. A living will, and these come in many different forms, states your personal desires for your end-of-life care or when you no longer can. And a living will is very important to help make sure your desires are known and carried out. And then the last one is something that we encourage everybody to speak to their primary care physician or other healthcare provider. It's called a Massachusetts Medical Order for Life-Sustaining Treatment. This lists the very specific medical decisions you have made for what you want as end-of-life care from a medical and non-medical perspective. But a medical order for life-sustaining treatment does need to be signed, not just by you, but by a physician. So I encourage you to think about these legal documents and get them in order. You don't have to get them in order in 5 minutes. It's not a one-week project, but it is something that over time you should definitely have so that when the time is coming or is needed, these decisions have already been made and reflect what you really would want. So those are the legal things, and those are the things that will help your family and healthcare professionals take care of you in just the way that you would like. We are now going to move into talking about planning for emergencies. I know this doesn't sound like it's fun, but it's actually really important. It's really important to plan for emergencies, both that you will know that your documents are in place, you're all set for that, but now what happens when there is a hospitalization for an accident, when completely unexpected, it could be anybody of any age. COVID is something we have to know that anybody can get exposed to. We might have to be tested, or an admission to the hospital might happen. These are emergencies that are health related and medical situations. Medical and health issues can occur when you're traveling or away from home. So planning for those kinds of things is probably something you would understand you need to do, but isn't something that you necessarily want to take care of. But we really encourage it. The second area of things that you don't necessarily plan for but are emergencies are sometimes something that comes up in a very big hurry. We've all seen climate change. We've all seen terrible storms. We've all seen bad impact on our houses, our homes, our property, our vehicles. So severe weather situations can happen, and these require a rushed need to leave home. Loss of power, no generator, no water, no food. And another important reason to be prepared for rushed leaving home is you might need to help someone else, in which case we very much recommend you put together something that one of my colleagues refers to as a go bag. If you had to go, 1, 2, 3, get out the house. Things that you might want to have in a small suitcase or a bag so that if you had to leave your house in a hurry, but for a few days, similar to what happened at Cape Cod and the South Shore recently in Rhode Island. Recently, we had that very big storm and 600,000 people were left without electricity and water and such for many days. They had to leave the house really fast. I suspect those who had been prepared with a go bag that had things like medication, some clothes, maybe even a power cord for the phone because they'd want to have that. And who knows, they might have had a pet. And if you have a pet and you take the pet, your go bag should probably have a supply of some of the pet's food and maybe even medicine if they take it. So the idea here is this is planning for emergencies. They may never happen, and that would be great. But having these things in the back of your mind, you know they could happen, it really makes sense to be prepared. And packing a go bag, a small suitcase, maybe that you leave in the front hall closet or somewhere that you know you can just pick up and you'll be ready to go in a bad situation when there might be an emergency, which we hope never happen, but they could. In addition to the go bag, having emergency information that would be really useful if you are out of your home, if necessary. Information like personal contacts, so if you needed to contact people, they might be on your cell phone, that would be great, but make sure you have them. Professional contacts, because if some damage happened and you needed to contact your lawyer, an accountant, your financial advisor, it's important to have those contacts. Again, those can easily be right on your cell phone if you have them, but it would be really good to have them in a really easy place in with that go bag. A list of personal accounts and contact numbers. This is for financial accounts, for insurance policies. Again, if it was an emergency, you might need your insurance coverage and know what it is and know where to call. Debit and credit cards, mortgage information. You want those contact numbers and the account numbers in a very easy place. Service providers, so utilities, pharmacies, mail-away pharmacies, all of these things would be very important to have in an emergency. And the last one is access numbers for online accounts. Now this can be essential, but it also is something you might want to have a copy of your user identification numbers and your passwords in a separate place in a secure location. So for example, if you have a safe deposit box or if you have something like that, having your user IDs and your passwords in a safe place like that, in addition to having them in your emergency go kit, would be very useful. So that's the story about what we think you should do for emergency planning. And a little layer on top of that is planning for hospitalization during the COVID-19 pandemic. Now I know it's the end of 2021 and we are hopefully in a less risky environment for COVID. However, it is not gone and it is not going away, and we have to be prepared just in case, again, just in case we need to go to the hospital during the COVID pandemic rules. So not all of these restrictions will be in place, hopefully in 2022, but you can expect several of them will, like the patient is likely to have to go alone to the hospital. Visitors are not currently permitted. The patient may have to go to an unfamiliar or different hospital setting or a different medical setting, even if it's not a hospital. And it is very useful to have information that can help your caregivers help you. So be ready to help your caregivers help you. And I have good news coming up now. We have a solution. We have a solution about being ready in case you, heaven forbid, need to go to the hospital during an emergency of COVID happening in the hospital. So a grab and go kit. That's what we recommend you create. It is in a baggie, so everybody's got baggies. It looks like this, and it should be hanging on a hook or on a cabinet so that it is very easy to find. It is right there. And it has the name of the person who is going, who is the patient. It has basic information about the patient on a piece of paper right there in the plastic baggie. It has specific needs of the patient, like their medical conditions, like allergies, like whether they have implantable devices, which causes different issues in a hospital setting. What can the patient do? Do they walk? Can they hear or see without extra care? Do they have cognitive disabilities? So can the patient understand and answer questions? This is very important. So in the grab and go kit, you would have basic information about the patient, specific medical and health needs about the patient. For the hospital staff, another page would be a list of medication doses, all of your medications, the medical conditions that a person has had, including past surgeries and hospitalizations, copy of insurance cards, signed HIPAA release forms. If you don't have that at your hospital, ask your doctor to give you one. Healthcare representative, the form we talked about before, and a medical order for life-sustaining treatment. A medical order for life-sustaining treatment looks like this. It is a bright color. It is a few pages long, and it is filled out by you and your doctor. It is very important for the hospital staff to know what orders you want carried out if this is an end-of-life situation. And for your family, in your grab-and-go kit would be any advance directives, what your living will might be, and your power of attorney, both the durable one for money and the healthcare representative, as we said before. So you want to help your hospital caregivers, you want to help your family, because during the COVID pandemic, we don't have any choice but to face the reality that this information is needed and we might not be able to provide it as the caregiver. In addition to having emergency information with the name of the patient in your go bag, you would create a grab-and-go kit that has the documents we mentioned, and very important, a bright color, pink in Massachusetts, medical order for life-sustaining treatment. How do you get all of this? There are resources to help you, lots of online resources. These resources, I'll highlight what they are, but these will be on Senator Eldridge's website for seniors, because these can help you assemble all of this, get prepared. So benefits, the resources that we have for benefits, Social Security, Medicare, Medicare Rights Center, and Veterans Administration. These are all places to get information about your benefits. Other information sources are your town senior center, where SHINE representatives are available. They might be available online. They may not always be available in person during COVID rules, but they're very, very useful resources for information. Home Health Compare and Nursing Home Compare are websites that the government maintains to help people who need to select a facility or a service provider for home health care or for nursing home services, to pick a nursing home or to pick home care providers. Then there are aging life care professionals, elder law attorneys who you might need to get in order to get your affairs in order. And then there are 3 resources of information that I strongly suggest you think about accessing. One is called The Conversation, theconversationproject.org. This was started by Ellen Goodman, a former Globe reporter, and it is about starting the conversation with your family and for yourself, what you want, what they want you to know, what you want them to know. It's a very useful place to start thinking about this and talking about it. Then there's something called 5 Wishes, which talks about, again, what you want. It's not really health related. It's if you had your 5 wishes about what you would have in a medical situation, that's where you get to think that through. And the last one is Harvard has a lot of tools on their health.harvard.edu advanced care planning. So the last 3, the Conversation Project, 5 Wishes, and Advanced Care Planning are all very useful places to get started on being prepared. We hope you never need to use an emergency kit. We hope you never have to have a go quick incident, but if you do, we really recommend you get that go bag ready and you have the documents in order and you set up a grab-and-go kit, especially if you have to go to the hospital or somebody you are caring for has to go to the hospital. I thank you for your attention. We're going to take questions and I will answer them. And if we can't answer them on this moment, we will get the answers onto Senator Eldridge's website. Thanks everybody for coming. We wish you a wonderful holiday season and we wish you good weather as we go through the winter of 2022. Be well. Thank you for listening. Ellen Feinsand wishing you a happy holiday season. Hello, this is Ellen Feinsand at home. And I wanted to answer some questions that came up throughout the presentation. Joanna and someone else asked, will there be access to this conference content, the presentation and the slides? And yes, Senator Eldridge's website will have all of the presentations that were given today. And so you'll be able to access it that way. Loretta asked regarding the increase in Social Security benefits, will there be an increase in tax withholding on the higher benefits? The answer is yes. If you have already given, if you are already having tax withheld from your Social Security benefits at a set percentage, like 10%, yes, because the benefit amount will be higher, so will the amount that gets withheld at that percent. Now, you can request a change in the percent, or you can request a change in the amount, but that would require getting in touch with Social Security and making a new election. But yes, that there is a higher amount based on the higher benefit. Stephen D. asked, is there supplemental coverage for hearing aids, and do we have specific names of contacts for this coverage? The answer is there is supplemental coverage for hearing aids. No, I do not have the names of specific contacts for this coverage, but we can do some research and we can provide that, again, through Senator Eldridge's website with seniors, Senator Eldridge's website /seniors. And that I hope will be able to answer your question. And then Patricia asked, can the slides be viewed at a later date? And again, it's the same question. I will give over there. Senator Eldridge's website is being posted right now. Senator Eldridge, would you post that again, Afnan? Thank you. Anyhow, the slides can be viewed at a later date on the website. So now, do we have any other questions that didn't come in through the chat room yet? Yeah, so it's www.senatoreltridge.com/seniors. Well, again, I thank you again and wish you good health through the holidays and all through 2022.